A very good morning to all. I am Dr. Uttara Mohan from the IAP digital team. We are live for this webinar on IAP YouTube channel. I request all to subscribe to the channel to get regular notification during our webinars. The topic for today's webinar is Podiatric Insights by resource person Dr. Sarika Jambulkar. This webinar is being organized by IAPWC Mumbai District team. The team members include Dr. Deepika Makwana, Dr. Masuma Ladiwala, and Dr. Urvi Katakia. Now I request the Mumbai team to please take over.
Hi, good morning everyone. I am Dr. Deepika Makwana. I would like to give you a brief introduction of IAPWC. IAP Women's Cell works under the guidance of our national head Dr. Ruchi Vachne and IAP President Dr. Sanjeev Jasar. We have 5 zones in India with the heads for each. Dr. Pooja Kamble is the West Zonal Head. The state team of the IAPWC Maharashtra includes our state coordinator Dr. Suvarna Ganve, joint coordinator Dr. Snehal Patel, sub-coordinators Dr. Uttara Mohan, Dr. Priya Karande and Dr. Nirali Sanghi. In Maharashtra, IAP Women's Cell has conducted many low-cost activities like CMEs, workshops, public awareness campaigns, health camps, blood donation camps in various districts since 2018. We have also conducted webinars on various topics in orthopedic, neurological, pediatric, women's health, cardiopulmonary, sports and geriatric rehab. In the past 1 year, IAP Women's Cell Maharashtra State has conducted total of 103 activities. Today's webinar is on Podiatric Insights conducted by Dr. Sarika Jambulkar and it is being hosted by Mumbai District team. I, Dr. Deepika Makwana, is the coordinator of Mumbai team. Dr. Urvi Katakia and Dr. Masuma Ladiwala are my sub-coordinators. I would like to give you a brief introduction of our today's resource person, who is our Dr. Sarika Jambulkar. She is the co-founder and member of WeCare. She is the eminent physiotherapist, effectively practicing comprehensive podiatric with vast knowledge about the foot, ankle and lower limb biomechanics. She has done her Masters of Physiotherapy with specialty in musculoskeletal science from BYL Nair Hospital and College, Mumbai. Further, she has gained in-depth knowledge about foot, ankle and lower limb biomechanics and from LBG Medical UK. She is practicing podiatry since past 12 years. She is also the member of Indian Podiatric Association. We welcome you, ma'am. During this webinar, if you have any queries or any questions to ask to our resource person, you may post them in the chat section. Thank you. Over to you, Dr. Sarika.
Thank you, Dr. Deepika, and thank you, Dr. Urvi, for coordination with me, and thank you, IAP Women's Cell, for giving me this opportunity. I'd like to start with sharing my screen. My screen is visible, right? So before we begin, I just want to confirm my sound is audible and my screen is visible.
Yes, ma'am.
So Dr. Deepika has already introduced me. So I would like to start with, how I came into the podiatry. So basically when I got my admission in a bachelor in physiotherapy, it was in like about 15-20 years back. That time there was not much awareness about the physiotherapy. People were hardly knowing, what is physiotherapy, what they do and all. Okay, and after finishing, when I finished my graduation, the scenario started changing. People started getting more about the physiotherapy. And after graduation, like any other student, I was like, okay, pass both medical padhai kiya. Now I'm done. I can't study further. medical studies so exhausting. But that was the time when the people started getting aware, and the masters had also come into the picture. That now people were asking, okay, who is orthophysio, who is a neurophysio. So then I decided to get the admission in masters, and I got admission for masters in musculo in BYL Nair Hospital. So I finished my masters there. After finishing masters, still I was very sure that I need to get into something further specialty, so which can help me to build my unique identity. So I was looking for other options, like even in musculo, what further special thing I can do about. And when I was doing a job, I was side by side exploring the options. And then I got introduced into the podiatry, and I found it very interesting because it's directly hitting the root cause of the problem, and the result which we got was like really, really miraculous, and that kind of built my faith more into podiatry, and that's why I decided to dedicate my practice into the specialty. So I decided that later on, I was meeting one doctor and we just had the introductory session. So she asked me, Sarika, what are your specialty? I said, I am specialized in musculo physio. She's like, no, but there are physio who are specialized in shoulders, spine. So I was like, okay, I'm specialized in foot and ankle. So that was my main aspiration to join the podiatry. So as we can interact through the chats, I would like to ask, from which city you are, and are you also inspired to get into something specialty to build your career, which will shape your career in the better way. Can you help me with the typing in the chat box? It will make it more interactive and interesting, and then immediately we will start with our main presentation. Okay, we'll move further ahead. So today's topic is about the podiatry. Okay, and let me ask you one question. If someone has any problem, usually we have a specialty doctor. We know whom to consult. For example, if someone has the fever, they will go to their family physician, right? General practitioner in general. Now, suppose if someone has a fracture, whom they will consult? They will consult with some orthopedic surgeon, right? Now, if someone has the foot issue, where people should go? And that is where the issue is. People don't know if they have any specific foot problem, where they should go. And this is a big question mark even the general population has, and even it is there among the medical population. For example, a person can visit the orthopedic surgeon who may prescribe him some painkillers and all that, which can help for the temporary relief. He can also visit the physio, where the physio can guide them about some strengthening exercise for the leg. But for example, if the person has a flat feet and his walking pattern is not right, then where should right? So that is where the foot is important, and the consulting with the podiatrist is important. So we'll come to the part what is the podiatry, but before that, let's see why foot is important. Okay, so the feet are base of our body, right? And for any structure to remain stable, it needs a stable base. Okay, and if the base is altered, the building or structure will collapse, right? So same case in the foot, the whole entire posture will go into malalignment. Now this is a very effective image to show you that. For example, because of any reason, if one side arch is reduced or flattened, that will bring their knee down. Okay, the knee will go into further valgus or internal rotation as well, and the pelvis will come down. Okay, and that will affect the spine, which will lead to the scoliosis and the unevenness of the shoulder also. So this start kind of problem begin from the foot, but it can cause the discomfort anywhere up to the spine. Okay, so even if the person has the knee pain or the back pain, there are high chances that it can be connected to the foot as well. So standing and walking is very integral part of our daily routine, right? And that's the main reason the foot problem will get ignored. Now, why ignored? Suppose, for example, if someone has any shoulder pain or back pain, they'll be like, okay, I have little problem. So they will try to take precautions, that they will try avoid lifting anything heavy with that shoulder, or they will, avoid bending down. But in the foot, how they can stop, standing and walking? Maybe they will relatively reduce it, maybe stop doing workout or stop doing running. But whatever routine standing, like for example, if there is a housewife, she will have to stand in the kitchen, right? So she can't completely reduce that. So that's the reason the foot doesn't get rest, and these problems goes into chronic. It get converted to chronic problem. So that's why it get ignored. Obviously, the people, they don't have a knowledge how it should get treated also. The feet is the ability to move from one place to other, and that is the definer independence and dependence. So as a physio, we know how much that mobility is important for a patient, okay, because we are working on making them independent on their day-to-day activity. So the physio is the primary person who understands that important. Now let's see some important facts about foot and ankle and lower limb. So we have about 26 bones, 33 joints, and 107 ligaments and 19 muscles. And every person takes about 8,000 to 10,000 steps per day, which add up to 175,000 kilometers a lifetime, and which is enough to grow around the earth 4 times. So that much amount of standing and walking. So we all have studied the foot and ankle biomechanics, but honestly, like at least in my case, in the second years of bachelor's, I always skip some complicated things. Like I will study the shoulder and elbow, but wrist and hand is a bit complicated. So I used to skip certain part. And even in the legs, I will say we know the knee joint is very important. So there's a high chances that it will come in the long question for the examination. But foot and ankle is a bit complicated. So maybe I will study up the talocrural joint and subtalar and Geka sub, even if I read it, it used to be like, volatile thing. So foot and ankle, the biomechanics wise also, it's very complicated to even remember. And another part is the clinical implication. For example, if we have studied glenohumeral joint, then later on you have studied also mobilization of glenohumeral joint, right? So you really remember how the convex concave rule works for the glenohumeral joint. But same thing is not for the foot. Okay, there is hardly anyone who will remember how the convex concave rule for the foot and ankle. So that's why we need to really brush up about how the foot and ankle works. So we need to look after our feet like our vehicles. Okay, if the wheels are not balanced and if they are out of alignment or there is a shock absorption or bottom, the vehicle will rattle, right? And 3 out of 4 people experience serious foot complication in their lifetime. I know like many people who has a 4-wheeler, and if they start driving and if they feel something is wrong with the wheel, the air is not proper, they feel push to anshi ke chala, they will immediately stop the car and they will get their tires checked, right? So that much importance we give to wheels of the car, but do they give that much importance to our feet, which is our important vehicle for our standing and walking? So let's see what are the common conditions which are covered by the podiatry, or which the podiatry plays very important role. And all of these conditions you will see many physios who are practicing, you must be seeing these conditions on very day-to-day basis. Flat feet is one of the very common problems, so common that people are taking it, this is normal, like you can't do anything about it. The foot is flat, so foot is flat, you can't do anything about it. Then there is a plantar fasciitis, which always I say it's a common household problem. Like every house, there will be some woman or some one person who will have a plantar fasciitis or calcaneal spur as well, right? Again, if you are practicing physiotherapy in particularly muscular, then you must be seeing bunch of cases of the plantar fasciitis. The main thing is, they never get kind of a 100% relief. It keeps on, reoccurring. And even my day-to-day practice, every day there is like, 1 or 2 plantar fasciitis patient comes in who has tried lots of, physiotherapy in terms of ultrasound sessions and the plantar fascia stretching exercises, medicines. They have taken even steroid shots at that area, but still they are in pain. Then Achilles tendinitis, retrocalcaneal spur, recurrent ankle sprain. So many people with the flat feet can have a recurrent ankle sprain as well. Patellofemoral pain. Knee is as the most proximal joint of the foot and ankle. The malalignment of the foot and ankle definitely affects the knee joint as well. Then IT band syndrome, osteoarthritis of the knee, and recurrent back pain, and the corn and calluses. If you see, most of these conditions, they are reoccurring, okay? And we all know why things keep on reoccurring when we don't address the root cause of that. So IT band syndrome is one of the problems with the runners, and it keeps on reoccurring. Knee pain. Persons start getting the knee pain from the age of 30-40 when there is not actually osteoarthritic changes in the X-ray, but still they are getting the knee pain, right? Recurrent back pain, no matter even if they are doing exercises, still they are getting the back pain. So how to identify if the person has the back pain and whether it's related to the feet? Okay, so the person's main aggravating factor will be the pain on standing. Okay, so if person's main aggravating factor is pain on standing, then definitely it's connected to the feet. Contrary, if the pain is increasing when they are sitting for long hours in their office, then it's completely mechanical. It's because of the weakness of their core muscles. So you must be getting all your patients with all this problem. So how you will identify whether that patient has, foot problem, or whether this problem is connected to the feet? So I'm going to give you some 5 pointers where you can very quickly screen your patients that, if they have any foot problems. Okay, so let's see what are the common signs, and it will take hardly a minute to, do that. So first is observe the patient's grade toe. Okay, so if there is any outward rotation, deviation of the toe, okay, or if there is an inward deviation of the grade. So this kind of the feet, particularly the first one, you must have seen it pretty often, right? The hallux valgus and bunion. Then you will also get patient with banana feet as well, where toes are completely in adduction. Then observe the other toes. Is there any clawing and curling of the toe? So the clawing will happen mainly when person has balance issues. Okay. And even the inward or outward deviation can happen with the toes as well. Bunion. Again, it's very common problem, and now in general, now even common population, they know this problem, right? And usually patient calls up with that, I have a bunion, and what we can do about that. And the usually thing is bunion, it will, increase with the age day by day. And now we get very old patients whose age is 60 plus, and now their toes are literally overlapping. So the deformity gets worse day by day. So even if you don't ignore, the one thing is, if you ignore, it's going to increase, or the deviation will be more and more. So calluses and corns. Being a physio, maybe directly we don't deal with the calluses and corns, but if someone has any foot problem, foot deviation, they will have a calluses. And why it happens? It's because of the, their faulty arch pattern on certain areas of the foot. They will exert more pressure. So that's why the calluses and corn happens. And on prolonged standing, the calluses turns into the corn. So the first image, this is a callus. So calluses is a thick skin, okay, and they are usually little broad, and many times it is not much painful. And these are the corns, which are very small. They are like stones digged in our skin, and usually it's very painful. Now, flat feet, that any physio, you can identify flat feet with your naked eyes. If there is any dropping of the navicular bone, It's called as a flat feet, means the medial arch will be completely flat. Now again in this image, if you see, though both feet are flat, the left side the deviation will be more, right? So we have to also analyze if that unevenness is there. Means there is definitely some asymmetry is coming from the proximal. That's why the deviation is more on the one side. So also you have to observe the heel bone, that is the calcaneum, from behind. Okay, so the center image, this is the neutral, where the calcaneus position is the neutral. First image where the calcaneus is in eversion and it will lead to the pronation at the subtalar joint. And third image, it's a supination. Okay, so because of the supination, calcaneum is going to inversion. So all this podiatry revolve around this, but it has lots of further deeper things as well. But identifying this issue is more important, and though people are aware about the flat foot and pronation issue, supination is also a big trouble, okay, because supination is a kind of rigid foot type. We can also call it as a base cavus foot type, and you see it puts lots of stress on the outer side of the ankle, and many people with the supination can go into inversion ankle sprain as well, which will be reoccurring. Or if someone is having a pain at the lateral ankle and it keeps on reoccurring, so this can be the main cause why it is happening and again. Now, one important thing is the number of enrollment happening in the marathon runners. If you have seen any marathon runner patient, they are very educated. They already have done lots of research about their problem, and they usually come to us, right? So usually runner will not call you up that I have a knee pain or I have an ankle pain. They will start talking it like, I have a pronation in my feet, or I'm a supinator, right? So we have a lots of now educated patients are coming up. So we need to also upgrade our knowledge where we can, address their issues more effectively. Also, we have to observe how is the patient, what kind of footwear patient is wearing, and how is the wear out. Like this kind of wear out you must have seen with the many people. So this kind of shows how is the person's walking pattern, and further if they will continue wearing these type of the footwear which is already worn out, it will further deteriorate their walking pattern more and more. So when we are having any patient coming for the podiatry assessment, we always instruct on the phone that you need to come along with your sports and comfort shoes as well. So that helps to better diagnosis also. So I was talking about the knee pain, that is a patellofemoral pain, as knee is very proximal joint to the ankle. So this is also a very clear image how foot and ankle alignment can hamper the knee. So usually flat feet or the pronation can lead to the knock knees as well. Okay, and if there is a high arch or base cavus foot type, that will push the knee into varus or the knee void. Okay, now this is in general compensation, but we all know the compensation never works same way in every case, though it can happen in 80% of the cases, but there are some 10-20% opposite thing can happen. That person will have a flat feet and they will have a bow legs, okay, or they will have a high arch and they will have a knock knees. So we have seen that kind of compensation as well, but this is the most common thing. And now when we are screening many of the young kids and all, many of them, they have a flat feet and plus knock knees, that even if they're standing with the feet apart, their knees are still touching each other. So knock knees is that bad. So if any patient is having any recurrent knee pain, then definitely we have to analyze their foot and ankle as well. So I had mentioned about the back pain, right? So how the foot and ankle can affect the back pain, because we all know our entire biomechanics, it's a closed chain. So any problem at the one proximal or distal joint, it can hamper the proximal structures, right? So for example, if someone is having heel pain and since long, so for example, even if they're having since 6 months, what they will do, they will try to avoid pressure on their heel area, right? So they will just kind of step on the toes, so that will lead to the hike of the pelvis on that side, and that can hamper their back posture as well. So they will start getting the back pain. So we don't know how exactly that a patient is trying to cope up with that specific heel pain. And even many times it happened that heel pain apne aap chala gaya. So actually wo apne aap nahi chala jata. The person tried to skip the putting a weight on that heel, and it goes into their subconscious pattern that they keep walking that way, and eventually the heel pain will go away, but they will start getting a knee pain on the other side. Okay, or they will start getting a pain at the outer side of the ankle on the same side. So this is all because of the compensation. Their heel pain is subsided, but because of the compensation, they will start getting some other problem. So this is the same thing. If the person will hike their pelvis to avoid weight on the heel area, temporarily the spine will go into scoliosis, and it will cause the back pain as well. So diabetes, again, India is becoming capital for diabetes. We all know that, and even in everyone's family now, there will be at least one person who will be having diabetes. And the long duration diabetes, it will also hamper the feet in the long term. It will lead to the poor blood flow, which is called as a PVD, and the diabetic neuropathy. You all know the symptoms of diabetic neuropathy, right? So I will not go into that. But now main thing is, say suppose if someone has a faulty foot pattern, for example flat feet or high arch, and they are already having calluses or corns, and then eventually later at the age they will be diagnosed with the diabetes. So these are the pressure areas who get converted into non-healing ulcers, and the person has to go into even amputation in this case. So in general, like in India or abroad, the podiatry is known only for the diabetic foot, okay? But it's not like that. We have to, start working, applying it from the young age, then we can prevent all its worst complication. There is also Indian Podiatry Association who works on more awareness about the diabetes, and I'm also a member of it. So there's still long way to go to create awareness about the diabetic foot among general population, but even in the medical population. Okay, because we all know how the prevention is always better than the cure. Okay, now suppose if someone is having all this above problem and foot pain, now what to do about it? Okay, so the main answer for this is the podiatry. So the podiatry is the science which is dedicated for the foot and ankle lower limb. Okay, and it is in practice in Western countries, America, Australia since many years, but India still it's a very growing thing. It's a beginning thing. So in most of the medical terminology, they are arising from the Greek, right? So paus or pod means the foot, and iatros means physician. So podiatrists are basically the foot as a foot physician who diagnose the foot and ankle lower limb related problem and also do the treatment of it. Now, how does it work? So as I said, why I got interested into the podiatry, because it was directly targeting the root cause of the problem, and that's why it gives very excellent result on recurring conditions. And how the root cause we can find out with the thorough assessment. Okay, what are the patient complaints? How is the patient's lifestyle? Okay, you can have some housewife who is standing a lot extensively at home, or you can have some marathon runner, you can have some athlete, or you can have some office going person who has the sedentary job, but maybe they are doing morning walk, right? So that is very important. What is the physical activity of the patient? Then visual inspection of the feet. What is the skin condition, if there are any corn and calluses? The foot alignment and posture, though it's mentioned in the one thing or gait analysis, it's very impossible to explain it in the one webinar. So we conduct full course for the physios where we in detail teach them about the foot and lower limb biomechanics. Okay, how to analyze the posture, how to do the gait analysis in the clinical way. We all have learned the gait analysis, but how to do it in a clinical way and how to even work on correcting it. Because the idea is not about knowing the foot biomechanics and only gait analysis. We also need to provide the solution also to the patient. Okay, so that is very important. So in our workshop, we give that all complete guideline about the foot, right from the basics of biomechanics, pathomechanics, how to analyze the gait, and how to then rectify it. Okay, that is very important. And the major foot size, okay, which is very important when we measure the foot length as well as width. Out of 10, 7, 8 people, they wear wrong type of shoes or the wrong size of shoes. And most of them, they land up in terrible foot problem because of this. Okay, wrong shoe size can give a ingrowing toenail. Okay, or in diabetic patient, it can give further to the ulcer and the amputation as well. So how we rectify that? That is in terms of the orthotics. Okay, we'll all know how the orthotics works. It's kind of reduce stress on the joints. It gives the stability, and we need, as per based on the assessment, it will correct the posture. For example, if in this image, if one side the pronation is happening, orthotics will correct it, and that is going to prevent further damage to all proximal joints. Okay, so many times there's a query, does it really work? Okay, because many times it happens the patient try with the insoles which are off the shelf. For example, they will try the silicone insole. If someone has the heel pain, they will try the silicone heel cups. Okay, but again that doesn't give a very long-term solution. So orthotics is not something someone can pick it up by off the shelf. So whether it really works or something, okay, I will like to share one video so you will get a better clarity. So I'm just pausing the video in between because this is the very interesting case. She is a RA patient, okay, and how the deformities, distal deformities increases in the RA. Now this lady is 60-year-old age now. She had come to me about 4-5 years back with very deformed the toes, okay, huge swelling at the toe. Now, when we advised her proper correction and she is using it very religiously, this is the scenario after 2-3 years. Now, imagine the RA case where deformity always increases with the age, or at least it will remain same. With the foot modification, the deformity has got better. Okay, so even the deviation of the toe is got corrected. The toe which was totally inflamed, that is also better. So because maybe the corn and calluses you don't have to directly deal with it, but you will get these kind of the patient, RA patient, or the patient who is having foot deviation. So the one thing is it gives very nice result, and that's the reason I got the opportunity to deal with many of the even celebrity patients like Nargis Fakhri, Smiley Suri. Many of them, they have come from abroad, so they were aware of the podiatry. So having conversation with them is very easy. The YouTuber Ashish Chanchalani, they have been very religious patients since long. So that is what happened when you built up your specialty. Lots of VIP or the celebrity population can approach it, but that's just kind of one small benefit of it. Main is there is still lots of scope for this, and there's lots of people suffering from foot problem. Okay, and now I'd like to share one testimonial of the patient with the flat feet.
Hi, my name is Akhila. I've been a patient of Dr. Sarika and Dr. Vilas's since 2016 now. I went to them originally for an ingrown toenail, which was very painful, and they not only helped me with that, but they've also treated it successfully and told me how to, at least wear proper footwear and all to avoid it. They also treated me for fallen arches and a plantar fasciitis problem that I thought was hereditary. Thanks to their inserts and their soles and their recommendations, I was able to go to the US within 6 months or so and walk around a lot for almost 1.5 months. They saved my vacation. I would say they've changed my life. I've taken so many family members to WeCare, and each one of them has come away completely impressed with how dedicated Dr. Vilas and Dr. Sarika are and the quality of care that we've received there. I've even had my sister from the US come, and they've helped us all so much. We're very thankful to have been their patients and will continue to do so. Thank you.
Okay, so it was just a feedback how it works for the patients. Now again, coming back to the main topic, footwear. So usually everyone buy the footwear which is comfortable to them. But the idea of comfort is very subjective. Someone likes the footwear which is very snugly fitting, so they will end up in wearing tight shoes, or someone like very spacey shoes. So in that case, they can even wear 1 or 2 size bigger shoes. Or some people, they will kind of avoid wearing shoes because they don't like the closed thing. Many of them, they have a broad feet. That's why they don't like the closed shoes, right? So what is the standardized thing? Okay, how you can guide your athlete patient or runner patient about how to decide the size of their shoes or what type of shoes they should wear. So there are some objective criteria about the shoes. Okay, the main myth in this is many people, they go for the flexible shoes or lightweight shoes. Okay, so see the flex test. Okay, ideally completely flexible shoes are completely no, because that will not give any kind of support to the patient. Okay, the shoe should be flexible only in the forefoot. Okay, completely flexible is complete. Little bit flexibility on the toes is needed because that helps to metatarsal break. Then there is a torsion test. Okay, you should not be able to twist the shoes. Okay, and the contour test means the ankle part, this part of the shoe. Okay, the ankle, we have seen that pronation and supination image, right? So the foot is already deviating, so the ankle support, okay, is important, which will control that pronation supination. So any shoes which is very flimsy at the ankle will not give any sort of stability to the foot. Correct shoe size, length as well as width. In India, the even shoe brands, they are not creating any awareness of there are shoes which are designed for the length as well as wide. Okay, so someone can have a wide fit, they need a wide width shoes, but unfortunately there is no awareness about it, right? So we have to avoid heels, we have to also avoid complete flat, we have to avoid the narrow footwear, which is very important. Now the narrow formal shoes in trend because it looks very smart, so many of the men, they will be wearing very narrow pointed shoes. And the similar way, women's formal shoes are further worst because they are kind of ballerina type, very narrow, there will be very less depth, so the toe deformities or bunion will increase day by day with this all problems. And many times it is possible at the young age, person is so look conscious that they will not give a hit for this all. Okay, but what will happen at the old age? So as I said, I'm getting so many patients who are in 60s at the young age, they have used heels and everything. Now even wear any simple footwear is difficult from them. Their mobility is so much restricted. So at young age, somehow, like if they are so conscious about the look, they will not follow the advice, but the later on it is going to give trouble to them. So we never know when the problem will start happening. So the main thing is solution is very simple. We have to give more attention to our feet. Okay, we have to also consult the podiatrist to address the root cause, and we are working on creating this awareness in physio because most of this patient with the plantar fasciitis, heel pain or the flat feet, they are going to consult with physio more. We all know how, like in general, physio we are very compassionate population and are always, money is another part of our private practice, but we always try to help our patient in all the aspects, right? So that's why we are approaching physios that, you can address this issue by yourself. If out of 3 people has the foot problem, then you get a abundant population to deal with, to treat or to help as well. And plus, you all have the basic the biomechanics. So understanding the foot and ankle, which is very easy for any physio. So that's the reason to create more awareness in the physio. We ongoingly conduct the workshop to train the physio in the podiatry, where we teach the lower limb biomechanics, pathomechanics, gait. Now we have also added the computerized the posture and gait assessment as well. So that is the add-on part. And we have made this workshop as one weekend we take online, where we teach their basics of theory, show them the videos, and they get a 1 week to revise it. And on the next weekend, we take the practical sessions of more. So we are conducting this workshop since past 6-8 years almost, and this workshop is also certified by the LBG Medical UK. And it's not just the 2 days workshop, but it's also we give an ongoing support to the patient. So there are some physios from the Pune or out of the Maharashtra who has done an earlier course. And even now, if they get any complicated case, they always discuss with us. They take their patient's video and then they send to us, and then they take our advice in terms of what kind of correction they will prescribe to them. So this is one ongoing thing. So I'm just trying to show one video about the workshop.
Dr. Sarika and Dr. Vilas have cleared a lot of our concerns. So I think it is a good thing, and I think every physio or every OT should come and do the course once.
Yeah, thank you.
Very good experience. This was my first, I think, hands-on workshop. I thoroughly enjoyed it, and I think all the physiotherapists must take this learning experience, because it is slightly different than our routine patients and practice or whatever we have learned throughout till now. So it will just like add that cherry on the cake.
So I'll share my number in the end, clinic number, where if you want more information. So this is the workshop which we are going to have next weekend on 25th and 26th Feb. We are going to have an online session, and on the 5th March in Khar, Mumbai, we'll be having practicals. So the actual total course fee is 10,000, but there is an early bird discount. It's 8,999. This early bird discount was only till 14th Feb, but since I'm doing this activity for the IAP, we have just upgraded it for today and tomorrow. So I will share the link on the WhatsApp soon, and where you can pay via that link with the early bird discount, or you can also save this number 86550. I will share it in the WhatsApp. So if you have any query regarding the payment, you can contact me on that. I will just share a bit more about the
यहाँ ये वर्कशॉप अटेंड करने के पहले हमको फुट के बारे में इतना कुछ भी नहीं पता था। हम ये सोचते थे कि कोई भी नॉर्मल शूज़ जो उसने दे दिए वो पहन लिए, लेकिन आज ये वर्कशॉप अटेंड की हमने, पैर के बारे में, फुट असेसमेंट के बारे में इतनी गहराई से पढ़ा और खुद के फुट को असेस किया, शूज़ देखे और इंसोल्स के बारे में पता किया। तो ये बहुत ही अमेजिंग वर्कशॉप है और इसमें हमें इतना अच्छा नॉलेज मिला है कि हम जाकर वहाँ पर सोसाइटी को ये सब इंफॉर्मेशन दे पाएंगे, ताकि वो लोगों को जो डिफॉर्मिटीज़ हैं, जो उनके बाद में डिफॉर्मिटीज़ होती हैं, उनको पहले से करेक्ट किया जा सके और वो अवेयर हो सकें कि उनके फुट में क्या प्रॉब्लम है। यहाँ ये
इट वॉज रियली अ नाइस वर्कशॉप। हम लोगों को बहुत ज़्यादा कन्फ्यूजन्स थे कि फुट डिफॉर्मिटीज़ में क्या क्या करेक्शंस होने चाहिए, हम लोग खुद कर सकते हैं या किसी से जाके कराना चाहिए। बट इस वर्कशॉप के बाद हमें पता लगा कि हमें खुद से करेक्शंस कर सकते हैं और किस डिफॉर्मिटी में क्या करेक्शन करना चाहिए, और फुट डिफॉर्मिटीज से हम फुट डिफॉर्मिटी करेक्ट करके हील पेन, नी पेन, इवन पोस्चर करेक्ट कर सकते हैं, वॉकिंग स्पीड बढ़ा सकते हैं, गेट साइकिल बेटर कर सकते हैं। इट वॉज रियली अ नाइस वर्कशॉप। इट वॉज रियली
So you can save this number, particularly the 8655085515. So if you have any query regarding the workshop, you can contact on that number. And right now, if you have any query regarding the presentation, you can post it in the chat box so we can have a QA session now. Yes, anyone has any query, you can. Post it in the chat. I have shared link on the WhatsApp. If you can share it with the participants. Yes, anyone has any query regarding?
Yes, Dr. Sarika.
Yes.
Dr. Sarika ma'am, there is one query on YouTube from Nidhi Makwana. She's asking if there is a pest cavus, then in knee, what deformity we will generally find?
Pes cavus hai?
If there is pest cavus, then in knee, what deformity we will generally find?
So usually pes cavus lead to the lateral, deviation. It increases the lateral rotation. So the tibia will go into bowing and it will also push the knee also into the varus. Okay, that is one. But also because of the pes cavus, if you see this is my foot, if it is going more on the outer border, toes will go into adduction. Okay, so this kind of deformity can also happen in the toes, like it can go into banana feet. Usually person with the pes cavus, they can experience the lots of pain at the dorsum of the foot. They can experience the pain at the lateral ankle. They can experience the shin pain. They can have a recurrent IT band pain as well. And usually pes cavus, it's a rigid foot. So, the shock absorption is less. When they strike the heel, okay, it will... I can't hear you properly. So if only deformities per se, that is what the tibia will go into bowing and the knee will also go into varus, and plus the toe adduction. In some cases, even the bunion can happen. So these sort of deformities can happen in the pes cavus foot type.
Ma'am, one more query. Is silicone insole preferable to be given for plantar fasciitis or heel score?
Not at all. Not at all. So silicone is just a soft material. So when the person is having pain, they might feel initially a bit better. Okay. But if you see the silicone material, it's very slippery and it's very heat generating. So when the patient uses it for 5-6 months, it causes lots of burning sensation in their feet. And it kind of, make their shoes also unsteady. If they are using only silicone heel cups, what will happen? The heel is kind of raised, so the more pressure will come on the forefoot. So we have also get patients who use the silicone heel cup since 6 months. Now their heel pain is better, but now they have developed metatarsalgia because now pain is coming more to the forefoot. So usually it's totally pointless. In many cases, patient also, even the heel pain doesn't go away with that insert. So usually patient comes after that. So silicone inserts are totally, pointless thing. Here we are talking about correcting the foot alignment. Okay, so we have to support the plantar fascia. If the foot arch is dropping or if the pes cavus is there, accordingly we have to support whole plantar fascia. So that type of orthotic correction they need and not just the soft inserts.
Okay, ma'am. One more question. How long does the patient need to follow up with a podiatrist for correcting the foot alignment?
Very good. Okay, so the best advantage in this is it's done in very less number of sittings. Okay, so after first consultation and giving the prescribing the basic things, we call patient for the follow up after 2 or 3 weeks. So when they get the used to the basic insole, and if there is any add on correction, or if we have to prescribe any specific exercise, that is done in the follow up. So it's usually done 2 or 3 visits initially, and then patients need to follow up once in a 6 months or once in a year. So just to get their insoles checked or get their shoes checked if there's any change need to be done. We also deal with many NRI patients. They visit, once in a year to the country. So usually that once in a year they do follow up and get all things done. So that's the best thing about it, that it's done in very minimal setting. And plus we prescribe prefabricated insole, which are also called as a bedside orthotics. So it's done on that same day as it is. Like, patient doesn't has to come 2-3 days after that to get things or get their insoles. Yes.
Okay, ma'am. Ma'am, Nidhi has asked again about the regarding pest covers, its effects on knee joint.
I didn't hear the first word. First, what is it?
Regarding pest covers,
Hmm.
its effects on knee joint.
Yes, big time. Okay, so as I have said, the base cavus is the rigid foot. Okay, so usually there is something called as a shock absorption. We understand in terms of four-wheeler, but if we see it on the feet, when we strike our heel on the ground is also going to react with equal amount of force. So in rigid foot type, that shock absorption is very poor at the ankle, and that's why this all stresses come at the knee joint. Okay, that's the one factor why the high arch or base cavus foot type lead to the more stresses at the knee, or it result in the knee pain. Plus, it pushes the knee and tibia into lateral rotation, so it increases the lateral rotatory stresses. That's why again it causes the knee arthritic changes at more. Like it start from early age, even literally in 20s as well.
Okay, ma'am. One more. Do you also include electrotherapy along with your foot correction treatment?
No, I don't usually. See, most of the patient who visit me, they come really from far, like across anywhere in Mumbai, Thane, Kalyan, and outside Mumbai also, and the NRI patient as well. Most of the plantar fasciitis cases also, after giving the correction, in 2 or 3 weeks, there even no matter how acute plantar fasciitis pain is, it goes away in 2 or 3 weeks. So usually they don't need the many sittings with the electrotherapy and all. So in the follow up, I prescribe the set of exercises which are specific for their arch pattern. Okay. For example, pace cavus foot hai, I will focus more on the calf stretching. If there's a flat feet, I will focus on the tibialis posterior strengthening. So usually I don't use the electrotherapy.
Okay, ma'am. One more. Suggest some preventive measures for college going students, as most have flat foot nowadays.
Yes, right. So the best thing is, using sports shoes. Okay. And for females, avoid using heels. Because many females with the flat feet, they feel little more comfortable in the heels. So they, even on day-to-day basis, they go for the heels footwear. But then later on, it will put a huge toll on their leg health. Okay, or even they can get a corn and calluses. So using sports shoes when you are going to, because college population means it's a very active population, right? They will walk a lot to the college, they will travel by train, or they will climb the floors. So particularly the physios where they have to stand really for long hours. So using the sports shoes will give a lots of and plus if the flat feet is severe, then get the proper orthotics done for their sports shoes, that will work best.
Okay, ma'am. Last one. Details of certified courses for podiatry and certification level.
It is just share in the chat box. If you can post this in the YouTube, they will get a more link. So there is an Insta module link which has more details about our workshop, like what it contains, how is the timings and everything. And also you can share the number 8655085515. If you, I'm not sure if you can post it there.
Ma'am, you can post it in the chat box.
1 minute. I'm not able to. Right. If you can post this to all candidates, you can WhatsApp on this number, and my team will get in touch with you regarding the workshop. If you have any query, just put the WhatsApp message on it and post your query, and our team will get in touch with you. There is some Naila Ilahi has raised the question. Can I take her question, Dr. Urvi?
Yes.
Yeah.
She can unmute herself and ask the question.
Yeah. Yes, Naila, unmute yourself. Tell me, you can tell me what's your question. Naila Ilahi, are you there? You have raised a hand. You can unmute yourself and ask question.
Hi ma'am, my question is, can you organize this workshop in Delhi?
Oh, that's the plan, but we haven't decided yet.
Okay, because Mumbai is very far, na? Delhi is center. Everyone can join in Delhi, na?
So for this work right now, we are having 2 candidates coming from Delhi. Okay. So you can, if you just note that mobile number and you can drop a WhatsApp message on it. So if we are having any upcoming activity in Delhi, then surely we'll update you. But immediately it's nothing scheduled. As of now, we are doing it only in Mumbai. So usually we have a candidates coming from Pune, and at a time even Bhopal, MP, they are traveling to Mumbai. But you can attend our online sessions as of now if you can't travel. And for the further practicals, if it is happening to Delhi, you can again attend the practicals there. So that's why we have made it, online and offline. So at least part of the workshop you can attend where you get a pretty clear idea about what are the conditions it covers with and everything. So on that link, there is also
practical session
option
is different from online, na?
Yeah, of course. But that is the basic foundation of the practicals. So if you'll initially do that online session, later on you can plan to attend the practicals.
Actually,
We'll
I'm working
surely
in the
have
government
something in
sector,
future.
na? I'm working in government sector in Kashmir. So I have seen lot of patients like pest planners, pest caries, these deformities, plantar fasciitis.
Right. So immediately there's nothing planned, but in future surely, but it's not sure yet. So meanwhile, at least you get some knowledge through online sessions, you can still start implementing it.
Okay,
And in the online session also, we try to include lots of videos and all to make it more self-explanatory as well.
Okay, thank you, ma'am.
Yeah, welcome. In that link, there are different payment options. If you can attend only online, then there are different payment options. So you can go through it. Save that link.
Okay, ma'am. Thank you.
One more question is there. Which orthotic brands do you prefer?
So as we are associated with LBG Medical UK, okay, so they kind of prescribe bio-advanced orthotics. Okay, these are prefabricated orthotics which comes in low, medium, and high density, and they are heat moldable. So usually, I personally prescribe it, and this workshop is also certified by the LBG Medical UK. And this all products are very research made, like in terms of patellofemoral pain or plantar fasciitis, how much is the effectiveness. So lots of research is done by worldwide, podiatrists and physiotherapy community in these products. So I use bio-advanced orthotics. Now these are not going to available off the shelf anywhere. This has to be prescribed by the either physio or the podiatrist.
Okay, ma'am. One more. For callus treatment, only shoe corrections are there?
Shoe, more than the shoe correction, I will say, see, the calluses are happening because of excessive pressure. Okay. For example, if someone has the flat feet, the foot rolls on the inner side of the feet. So they will have a callus on the great toe or the first metatarsal head. If it is a high arch, the fifth metatarsal head will be more loaded. So there they will have a callus. So in those cases, I prescribe orthotics, which helps to redistribute the pressure. Okay, so we have to offload the pressure from the corn or callus or even in the diabetic ulcer. Okay, and then it will start healing day by day. And as per their foot size, what's the type of shoes, what size shoes they should wear. That is the add-on guideline.
Okay, ma'am. And do we have to go for both offline and online courses?
See, that is always better, but that is up to you. If you can travel to Mumbai or if you are in Mumbai, then it's always attend both. Because जो हम theory में पढ़ा रहे हैं, that all practicals we will explain it. And plus in the practicals, we'll also show you the orthotics, how to, customize it on the spot for the patient, how to take the decision of the orthotics. Because that is something can't put in the online, right? So if you can attend online, offline, both, and online is the foundation of our practicals, right? So even if anyone is attending practicals, still they have to attend our online session first. So they will get the 1 week to revise their basics, and on the practicals, all the assessment which we have covered in online, we make them do on each other. So when we have, say, physio group of 20 physios, we make a group of three physios and they do their foot assessment on each other. And believe me, the foot problems are so common. Most of the physios, when they are doing each other assessment, they come up with lots of problems. Like many of physio has flat feet, many people have the bunion, or many have the corn or calluses as well. So even after the workshop, many physios, they opt for the orthotics for themselves. So the practical is a very different level. You get a complete hands-on or the assessment and the prescription. Yeah. Anything else?
So now we'll take to the vote of thanks. On behalf of IAPWC Mumbai District, I, Dr. Urvi Katakia, District Sub-Coordinator, would like to propose vote of thanks to all the dignitaries out there. Thank you, Dr. Sarika Jambalkar, for such an informative webinar and sharing your valuable time with us. A special mention to Dr. Sanjeev Jha, Sir, President of IAP, and Dr. Ruchi Vashti, Ma'am, National Head of IAP Women's Cell. I would also like to thank Dr. Pooja Kamble, our Zonal Head. Really grateful to IAPWC Maharashtra State Team, Dr. Suvarna Ganwal, Ma'am, who is the Maharashtra State Coordinator, for mentoring us in the best possible ways, and all the state coordinators, including Dr. Snehal Patel, Dr. Utra Mohan, Dr. Priya Karande, and Dr. Nirali Sangvi, for always supporting us. I would also like to thank all the participants for our overwhelming response for this webinar. Also would like to thank our technical team of IAPWC. Last but not the least, I, Dr. Urvi Katakia, Mumbai District Sub-Coordinator, would like to thank my colleague Dr. Deepika, Mumbai District Coordinator, and Dr. Masuma, Mumbai District Sub-Coordinator, for the efforts to make this event successful. Thank you one and all. Please share your feedback about the webinar. The link for the feedback form is provided in the chat box. Thank you all.
Thanks everyone, and I would like to thank IAP Women's Cell for giving me this opportunity. And thanks Dr. Urvi, Dr. Deepika, and all IAP team.